I have a really dirty stress ball that it's gross. I actually kind of don't want to touch that anymore. Just because we're professionals doesn't mean that we can't be cute and fun too. Hi, I'm Megan Singson, and this is what's in my bag as a medical speech-language pathology student. This is my massive pink bag that I call Nancy because she's so fancy. Okay, the first thing I have is like the most important thing, and it's just a lunchbox full of snacks because we're at the building or doing clinicals like all day long, and we just need snacks. You need applesauce, you need a fig bar, Dove chocolate, some protein. I got you covered. I'm a mom, so I always have food. I've got some headphones. I don't know what kind these are. I got them from my dad, and he didn't want them anymore, and I needed some. So there's those. You're seeing a pink theme. Anything that can be pink will be pink. So I've got a pink planner. Half of my brain is in here because I can't remember what's going on. Okay, I've got these two little bags. One of these is just full of cords and cables and everything that I need to charge my stuff. And I used to just have them free floating, and now I have them in a bag. So we're evolving and we're getting better. So great. This is what I like to call the mom bag. If you need emergency, a hair tie, or toothpicks, I don't know, gum, anything you need, you could probably find in this little mom bag. You hit me up, I got your back. That's what I'm for. Got a notebook. We have $20 peeking out that I got from somebody. Oh, I just made this for a client. I have a client with aphasia, and it says, "I'm not dumb, you're just impatient. I have aphasia, please be patient while I find my words." And it's a little book with all of these different car parts in it because he's a mechanic and he sometimes has a hard time finding his words. So I made one that's got like transition parts and the brake system, and I'm really proud of it, especially the graphic. I'm probably more proud of the graphic than the rest of the book. Boom. Beautiful. This one is really important. This has a lot of my clinical resources. So it's got stuff like initial L smash mat stuff to put Play-Doh on when you're working with kiddos on their initial L sounds. There's a lot of L stuff in here because that's a really hard word. I wasn't always this organized, but I'm starting to get my life together, so. Ooh, and I've been looking for this. I have a picture of a cheetah to help when kids need to increase their rate of speech. And then again, anything that can be pink will be pink. So I've got a pink laptop. This is absolutely essential. My whole life is on that. I recently became the owner of an iPad, and I'm so happy with it. And it's been especially helpful for taking notes in class. Somebody put me onto GoodNotes, which is like, it's the best thing ever. So I download the PowerPoints from different classes, and then I can write directly on the PowerPoints with stuff. It's also really helpful in clinical assignments when you're trying to work with a patient and you have the lesson plan out and you can make notes and take data as you're going. I love it. It's the best thing ever.
We have noticed there's a lot of pink. Can you explain why you like pink so much, or why all your stuff is pink?
Yeah, I'm a big fan of pink. I've always been a big fan of pink, especially in the medical field. Sometimes you can get a little bit dreary. Incorporating a little pop of color in your outfit or in the stuff that you have, it's good for your mental health, and it also just signals to your patients and the people that you're working with that you're a nice, fun, approachable person. You know, the medical field doesn't have to be like boring. Just because we're professionals and we're really good at what we do doesn't mean that we can't be cute and fun too. So I have, it's a little like alien, and it's glow in the dark and it has a cow. And so when you pull it, it looks like it's abducting the cow. I'm a child. I'm having so much fun. Also, the sticker says, "I teach kids to talk back." Speech-language pathology. And then that's me. I have a really dirty stress ball that is also pink, but it's gross. I actually kind of don't want to touch that anymore. Blech. I had got this from one of my faculty members. It's like putty. It helps me to focus in class. But it's also kind of a gross color. And it turns yellow, which I think was supposed to be fun, but it just kind of gets grosser the more you play with it. But this one I think is my favorite. I've converted a lot of my cohort to specs. It's magnetic putty, and I just like play with it like this, or I'll make little like soccer balls out of it and roll it around, or I'll make a tower. I promise I pay attention in class. I pay attention better actually if I have something to play with. If I had to come to school and only bring a few things, I would bring like this little pile right here is like the best. Oh, I also have lip gloss. Guess what color it is, guys? It's pink. that's pretty much it. I think that's everything that's in my bag. So I chose to go into specifically medical speech-language pathology because my dad had a stroke a while ago and he developed aphasia, which is a language disorder. And just watching him work with a speech-language pathologist kind of inspired me to look into the field a little bit more. I would love to work with adults who have aphasia, and this is honestly like the best place to learn how to do that. This program has so much more of an emphasis on the medical side of things. We get a lot of the neurological basis of diseases, the etiologies of diseases, and we just really dive into the anatomy and the medical side of things so that when we get out into the practice, into our field, we're super prepared to hit the ground running. We do more than just drill the letter R or help kids who stutter. Which are important too, but we do more than that. I was looking at a couple of different schools. I've always wanted to work with people who want to work with me, and seeing that our faculty really wanted to work with their students was a big draw. Again, the medical emphasis, we're one of like very few programs in America that have the medical emphasis too. So I think the medical emphasis combined with how great the faculty was about working with students and wanting to help us thrive and flourish were the two big factors for me. I'm Megan Singson, and this is what's in my bag as a Med SLP grad student. Thanks for watching.